Pasquale Montesano, spine surgeon. I'm one of Hoist Gracie's black belts, and because of that, I have a lot of jiu-jitsu guys, MMA guys, UFC guys, and women. We're here today learning endoscopic spine surgery. We're at Eloquence headquarters. We're at the West Coast one that's just south of the LAX airport, and we're here with
our favorite one,
the Obi-Wan Kenobi, or the Hoist Gracie of endoscopic surgery, Choll Kim. Choll is, first of all, a wonderful human being. He's just a master surgeon, and I'm very privileged to be able to learn from him and have him share his experience. He's one of the people that have really been the innovators of endoscopic surgery. Choll, how long have you been doing this for?
at least 20 years.
20 years. What got you started?
I saw my first open spine case and I thought, I know what I could do. I could figure out a way to do a lot of the surgery with less invasiveness, more minimally invasive. And I happened to have a very supportive department chair that said, you need to go see this person in Arizona who does back surgery with a knee scope. And I thought, really? Okay. And I learned how to do endoscopic surgery from Tony Young.
Tony Young.
He's the Hoist Gracie of endoscopic surgery. I don't deserve that, but
And
if you insist upon it, I'll take it.
And you were there working with Lynn, right?
Yes.
Yes. Who's unbelievable.
She's an OG. She's the tech.
Yeah.
And she knows how to do she knows how to do the surgery, and she knows all the tips and tricks. And like many things that we do, this is highly technical, and you can't do it by yourself. It's like Formula One racing. You need a really good team. So if it's not Lynn, it's got to be somebody like Lynn. Dr. Montesano is one of my heroes, and I'm so honored that he's here. And I'm just amazed that he's continuing his process of staying up with the technology. And this is one where even Dr. Montesano needs somebody like me to help him develop this program for his own practice, because the learning curve of endoscopic surgery is unusually difficult. So it's really important to train, learn, practice before you do your first patient, because let's face it, the first patient, the case has to go well. All the practice should be done on non-patients. So I really appreciate that you're taking time out of your really busy schedule to come all the way here and put in the time that's necessary. It says a lot about your commitment to your patients and to continuing on your learning progress. I'm very impressed.
I've been doing endoscopic work for about 5 years now. I've particularly been going from a lateral approach and just trying to push the envelope. And I've been very happy with the results that I've gotten. My patients have been very happy. And you just have to push the envelope all the time and keep learning how to do more and more endoscopically. And it's just, it's very, very, very rewarding. And I'm just so thankful to be able to learn from, somebody like you who's been at the tip of the knowledge here, getting it done. Now, where were you when you went with Tony?
Well, I was at UCSD on faculty, and I left for, I believe, 2 weeks. This was 25 years ago, and spent 2 weeks with him. And then I did a lot of labs, and I just took my time and started out with the easiest cases. And since 20 years ago, the technology has really improved. And I think what you're talking about, I learned through a lateral approach. We call it the transforaminal approach. And now we're doing today an interlaminar approach, which is much more directly from the back. And on top of that, instead of using one port, we can use multiple ports. So we went from a single port transforaminal to single port interlaminar to multi-port biportal interlaminar. And with those different techniques, you can pretty much take care of everything.
I think the key to learning is to check your ego. I remember a couple of years ago doing a case, and I had no idea who Lynn was, but Lynn was Tony Young's scrub for decades. And I was doing a case, and Lynn said, move your hand in this direction. And I heard this voice say, move your hand in this direction. And I did. And voila, the herniated disc appeared to me out of nowhere. And I instinctively said, who are you? But I think you have to be able to listen to the people around you, and you'll always learn. And always have that mindset of always being a student. Even when you're teaching somebody how to do something, you can learn from everyone in the room. So thank you very much for putting this on. Thank you very much for really being the driving force in the country behind this. And I'll tell you one thing, he does all spine surgery. And I think one of the things you have to ask a surgeon, like when you're doing, if you want a disc replacement, you need to ask that surgeon, so do you still do a fair number of fusions? If they say no, then they're probably pushing the envelope and doing disc replacement inappropriately. And the thing about, there's a lot of people out there that call themselves endoscopic surgeons, but the thing about Choll is that he's doing everything still. So he does what he needs. I'm not a golfer, but it's like carrying around a bag of golf clubs, and he's got the full set versus some people that just have one club in the bag. And you know, there's the saying, if all you have is a hammer, then everything looks like a nail.
That is so true. It's important to first establish an accurate anatomic diagnosis and then have a toolbox from which you can choose from to pick the best tool for the job. And that's so true.
I have a lot of patients that come to me and say, I want to have a disc replacement done. And I'll say, you're not a candidate for it. So the patients really have to understand, because there's a lot of misinformation out there. In fact, I took a test recently about internet medical information, and the fact of the matter is that 50% of what's on the internet is probably wrong, and a lot of what people have been told is probably not correct. So you have to find an honest doctor to treat your,
Yep.
and that doctor has to be able to be able to do everything, and not fit a square peg into a round hole. And there's times that people come to me and say, I want endoscopic surgery. And I say, well, you know, you have more of a deformity problem, and endoscopic is not for you. And you have to be able to, I see people out there say, well, I can do everything endoscopically. Well, everything can't be done endoscopically, just like everything can't be solved with one particular tool. You've got to have a variety of tools out there. But this is a great lab, and we're really learning a lot today on how to do the biportal technique, which I think is going to be a very big advancement for my practice. And thank you very much for.
Thank you.
It's an honor to be.
I'm honored.
Oh my
I'm
God.
honored.